As all of you know, overall patient safety is a top ANCC priority of care strategies. At this year's Magnet Prize winning hospital, pediatric patient safety is a focal point. They have taken the lead in developing a tool to prevent pediatric falls and thereby enhance safety. Their unique fall prevention program has been implemented, tested, and proven to be an effective tool in the prevention of injury due to falls. And now for the big announcement.
The really big announcement.
Roy, will you stay here and make sure and join us?
Sure, definitely.
The ANCC Magnet Prize goes to...
Nicklaus Children's Hospital.
Fabulous, you guys. Oh my God, you're the most gorgeous group I have ever Good job,
Wow.
good job.
Thank you all. It's so wonderful to see friends here in front too. So we're so proud to be here today to celebrate the professional excellence of nurses and your commitment to innovative best practices. On behalf of Nicklaus Children's Hospital and the Miami Children's Health System, we are honored to accept this award. So thank you, ANCC, and thank you very much, Cerner. So today, we would like to share our path to ensure the safety of children, thus reducing pediatric falls here and around the world.
At Miami Children's Health System, home to Nicklaus Children's Hospital, we're privileged to have some of the best caregivers in the world working together to make a difference for children. Any doctor on staff at Nicklaus Children's would be quick to relay that one of the central keys to our success is the leadership of our nurses, who routinely use evidence-based practice to enhance care. The Humpty Dumpty Falls Prevention Program is a case in point. Through the concern, curiosity, research, and innovation of our nursing team, we're now impacting children around the world, helping to prevent falls among hospitalized children. Our nurses are amazing, and I couldn't be prouder.
Through our Nicklaus Children's Healthcare Foundation, Jack and I have dedicated ourselves to supporting the well-being of children. We were drawn to collaborate with Miami Children's Health System because of the care team's commitment to care excellence and innovation. This commitment is truly exemplified by the Humpty Dumpty Falls Prevention Program. We want to congratulate the nursing team of Nicklaus Children's Hospital for making a safer world for hospitalized children.
We are indeed honored to be part of a health system that leads the way.
Thank you. So a little bit about us. Nicklaus Children's Hospital opened its doors in the 1950s as a specialty hospital dedicated to the eradication and treatment of the polio virus. The organization has 289 beds and is a part of a private, not-for-profit health system. Nicklaus Children's Hospital is the only licensed specialty hospital in South Florida serving children exclusively, offering more than 40 pediatric medical surgical subspecialties to 15,000 hospitalized children every year. Our ambulatory network is growing and sees more than 245,000 children every year. The system employs about 1,000 nurses and over 100 advanced registered nurse practitioners. The Department of Nursing is mission-driven in its dedication to nursing excellence. This is a big part of why we are proud to be a 3-time magnet designee. The magnet model component of transformational leadership is at the very heart of the organization's culture and values in generating new knowledge, and particularly the innovation we are describing today. Plus, we've been recognized by the American Association of Critical Care Nurses as a recipient of the Beacon Award for Excellence in all 3 of our intensive care units. And we're nationally ranked, thank you, by U.S. News & World Report in several specialties. But Nicklaus nurses have long been empowered to make decisions at the forefront of care. As a result, through exemplary professional practice, our staff and interprofessional teams came together to build a program that would be instrumental in promoting the safety and well-being of children.
As chairman of the Nicklaus Children's Hospital, I am very much like a proud parent. I'm always and everywhere telling anyone who will listen to all of the wonderful things that are going on in our hospital for the betterment of the children in our community and all over the globe. One of the programs that we are very proud of is one initiated by our nurses to minimize and prevent falls of our patients. This program has now been exported to every state in the nation and many countries throughout the world. It is a credit to our nurses and their leadership and their tenacity. We're very proud.
Thank you. The collaborative practice of caring for our patients at Nicklaus Children's Hospital is extensive. We are armed with evidence, we have built an innovative framework and structure, and we have applied technology that's advanced. Over the past decade, pediatric fall events have greatly demonstrated the need for patient safety precautions around the world. Safe Kids Worldwide, a global organization dedicated to preventing childhood injuries, stipulates that preventing injuries includes the potential injury from falls. The World Health Organization identifies falls as the leading cause of traumatic brain injury in young children. When the Joint Commission launched the National Patient Safety Goal in 2005, requiring organizations to have a pediatric fall reduction program, Nicklaus Children's Hospital launched its own journey in the design and development of a falls prevention program. First, we synergistically brought together content experts from across disciplines at all levels within our organization. We then began to analyze the available evidence. Our interprofessional team was passionate in their quest to bring new solutions to this age-old problem. Ultimately, our work led to the development and implementation of a plan to finally meet this need. The Humpty Dumpty Falls Prevention Program was born, and as word spread, other hospitals that had been looking for a solution to this common problem also reached out to us. Within the first year, the program was adopted by 16 hospitals. As of today, the Humpty Dumpty Falls Prevention Program has been implemented in over 1,150 facilities worldwide. Thank you. So, what difference have we made? Well, today it's about the evidence. You will find out from nurse leaders and nurse scientists who dedicate their efforts and expertise to the analysis of empirical outcomes and who strive to improve methods of assessment, intervention, and prevention. I want to thank and acknowledge my many colleagues and organizations, particularly those in fellow children's hospitals across the U.S. and around the world, and those who have joined us in this effort. With the methods, the spirit, and the heart of magnet nurses, we share the overall patient safety aim of protecting and healing patients who entrust themselves to our care. And now, I'd like to introduce a very key member of the Humpty Dumpty team, Nurse Director, Ms. Deborah Hill Rodriguez.
Thank you, Jackie. The development of the Humpty Dumpty Falls Prevention Program is truly nursing innovation at its best. The project began thanks to the inspiration and advocacy of our transformational leader, Dr. Gonzalez, who told you about the work of our interprofessional team. This team consists of direct care nurses, clinical specialists, nursing directors, nurse practitioners, nurse researchers, risk managers, and rehabilitative services professionals. The team exemplified professional practice by developing new knowledge, implementing the new program, and monitoring its effectiveness to this very day. The development team started by reviewing the existing literature. We quickly discovered that there was limited information in pediatrics related to falls among hospitalized children. At the time, the only prevention scales implemented in hospitals had focused on the adult population. Although the Moores and Hendricks scales were widely used in the adult population, and some institutions adapted these to fit pediatrics, their applicability to this population had not been tested. Once the team evaluated this evidence, they collaborated with other institutions and developed a pediatric falls prevention program from the ground up.
As a risk manager at Nicklaus Children's Hospital, I have a unique perspective regarding falls events. As such, I was invited to be a member of the Humpty Dumpty development team and remain an active member today in reviewing events. It is gratifying to see the improvement in patient outcomes and the awareness raised about falls safety that this program has enabled. Having a validated scale that can identify and prevent adverse events and injury in children is key in providing safe care.
We collected data for 200 historic fall events from Nicklaus Children's Hospital, and as well as another comparable freestanding pediatric hospital located in the Midwest. Based on the review of this evidence, published and empirical, a comprehensive falls definition was developed that would impact the future identification of all fall events. This definition influenced subsequent data collection, ensuring accurate benchmarking. Equally as important, the definition led to the development of the specific scale for the pediatric patient population. Drawing from the common data elements, literature review, and extensive experience, our team developed the Humpty Dumpty Falls Prevention Program. Our team members collaborated with direct care nurses to test the new scale. Patient fall risk scores, high or low, were determined with input with the direct care nurses. During the feedback, led to further refinement of the scale. For example, the original scale did not include gender as a common element. After further evaluation by direct care nurses, gender was included in the criteria. Today's scale includes 7 parameters with grading criteria. For ease of use, this scale was embedded into the electronic medical record. The team developed the complete complementary Humpty Dumpty Falls Prevention Program. The program consists of developed protocols for assessment with parameters, risk prevention, parental education, and staff policies. The result was an evidence-based scale enabling nurses to readily identify pediatric patients at risk for falls. Our emergency and outpatient departments also adopted and further adapted the program to meet the unique needs of their areas. One key component of the program is appropriate identification of children at high risk, ensuring that all hospital personnel who come in contact with the child understand that they play a key role in preventing a fall. A patient scoring 12 or above is considered to be high risk. The high risk assessment leads to specific protocols, including identification with the Humpty Dumpty bedside sign, an ID band, and detailed education with the patient and family. It has been over 10 years since the Humpty Dumpty Falls Prevention Program began. Committed to family-centered care, the Nicklaus Children's Hospital team continues to monitor the impact of this safety program. For example, the team discovered that parents are present with hospitalized patients more than 80% of the time when a fall occurs. Therefore, the team expanded its educational efforts to include essential parental partnering and education.
We have recognized an increase in fall risk awareness among the interprofessional healthcare team. Continuous staff education and in reinforcement of the Humpty Dumpty Falls Prevention Program, assessment protocol, and risk prevention protocols encourage an environment of safety and fall prevention. As the nursing director of the Inpatient Neurological and Neurosurgical Unit at Nicklaus Children's Hospital, improving outcomes in pediatric falls is paramount. The pediatric neurological patient is the highest risk population. Therefore, they require specific prevention protocols.
Working with industry leaders for pediatric parent education, the team designed and implemented a nurse-guided, interactive education module for the in-house television network. Improving patient safety through decreasing falls benefits our patients, our parents, and our nurses.
Good morning, my name's Elisa. I'm going to be your nurse today. What's your name and date of birth?
I'm Aaron Rodriguez, and I was born on June 22nd, 2000.
Hi, my name is Tabitha. I'm Aaron's mom.
Okay, so the first thing we're going to do, Mom, is our Humpty Dumpty fall assessment, which is a few questions that we're going to do to see if your child is at risk for falls. Okay, so we'll start here. So her total score for the Humpty Dumpty fall assessment is a 16. That's a high risk for falls. Okay, Mom, so the first thing we're going to do is put her Humpty Dumpty fall assessment high risk sign on so that everybody knows she's a high risk for falls. We're also going to give her a Humpty Dumpty fall risk bracelet to show everybody that she's a high risk for falls. Also, please make sure that you wear your non-skid socks when you get out of bed to prevent slipping. Okay, so this is what's called the gait belt, and I'll show you how to put it on, and with the handles you could prevent her from falling to the ground and hitting her head. So this is how you put it on. You put the handles to the back, around her waist. Okay, so you put it together. Okay, so you have the Velcro handles in the back, and if she's falling down, you hold her slowly to the floor.
Now, to discuss the empirical outcomes of the Falls Prevention Program, I'd like to introduce my colleague, nurse practitioner, and pediatric educator, Dr. Laura Hernandez.
Thanks, Debbie. In 2014, Nicklaus Children's Hospital joined a National Children's Falls Collaborative to continue to share and validate the results using the Humpty Dumpty Falls Prevention Program with benchmarking among national peer groups and other pediatric magnet organizations. Since joining 2 years ago, Nicklaus Children's Hospital has continuously demonstrated the lowest fall rate, well below the mean among the pediatric children's hospitals. In addition, as a member of another collaborative, the Children's Hospital Solutions for Patient Safety Network, we partner with other pediatric hospitals to establish and share best practices.
Arkansas Children's Hospital is a part of the Children's Hospital Solutions for Patient Safety, which is a collaborative of pediatric hospitals working together to reduce harm in hospital-acquired conditions, such as falls.
We chose the Humpty Dumpty Fall Scale to assess our patients' risk for falls as an essential piece of our falls bundle because safety is our core value.
Since implementation of the falls bundle, ACH has sustained improvement of patient falls with injury by consistently scoring below the benchmark as compared to other pediatric hospitals.
Through the collaboration with these peer organizations, we refined our fall event definition. It is a witnessed or reported unplanned descent to the floor or extension of the floor where the child is at the lower level from where they started, with or without assistance, and resulting or not resulting in injury by 2 classifications. The first classification is non-developmental, which includes falls related to accidents and unanticipated and anticipated physiological characteristics. The second classification is developmental falls. These falls are related to the motor abilities associated with age or a stage of development. This fall definition classification allows the team to continually identify and refine trends while implementing specific interventions to prevent falls. Some successful interventions include bathroom safety signage, fall safety bundles, post-event huddles, and a lessons learned educational series. One example being footwear safety. The overall success of the Humpty Dumpty Falls Prevention Program is evidenced by Nicklaus Children's Hospital's success throughout the organization by decreasing fall trends that have led to best practices. After implementing the Humpty Dumpty Falls Prevention Program, Nicklaus Children's Hospital has sustained a significant reduction in fall rates, including a decrease in severity and injuries while increasing knowledge and fall prevention among children and parents.
As an integral member of the Humpty Dumpty development team, eliminated patient falls has been our focus. Since implementation, the neurological unit at Nicklaus Children's Hospital has seen over a 50% reduction in falls.
Following full integration of the program across the entire institution, we have experienced a reliable decline in fall rates from 1.03 per 1,000 patient days in 2009 to 0.42 per 1,000 patient days in 2015, a 41% drop hospital-wide. Joining us in our mission for safety, other institutions that have implemented the program have also seen a marked decrease in fall rates. For example, the senior nursing officer of Hong Kong Sanatorium and Hospital provided a testimonial to us. They stated, "This program is proven to be a valid tool for recognizing high-risk pediatric patients in the inpatient units. This scale can give healthcare providers a point of reference when assessing children at risk for falls and may increase staff awareness of patients with high-risk scores for falls, which can promote staff compliance with fall education to families."
We've had positive outcomes at all Children's with the rollout of the Humpty Dumpty program here. On the inpatient side, we had 25% reduction in our fall rate. On the outpatient side, we also had a 25% reduction in our fall rate.
So I stand here today with much pleasure to share with you the outcomes of our program here and around the world since its inception. An incredible example is Karen McCoy, the Director of Nursing at Catskill Regional Medical Center, which says, "We have used the Humpty Dumpty program at Catskill Regional Medical Center for the past 6 years. We have had no pediatric falls since implementation." Time has brought forth change, growth, and improvement of the program, but most importantly, a passion for continued vigilance to the children and families we serve. Steady and sustainable reduction in inpatient fall rates demonstrate how a nurse-led innovation has become an international standard for improving safety outcomes in the care of children everywhere. And now, to further explain our program's ongoing research, is my colleague, Dr. Jessica Williams.
Thank you, Laura. As a professional discipline, the ultimate goal of nursing research is to inform nursing practice and improve the health and quality of life of our patients. As such, a deep understanding of the current needs and challenges facing patients and nursing practice is foundational. Whereas 10 years ago, no tools existed for identifying hospitalized children at risk for falls, significant progress has been made. Several pediatric fall risk assessment tools currently exist, including the Humpty Dumpty Falls Assessment Scale and others, such as the GRAPH-PIF, I Am Safe, and CHAMP scales. As with any innovation, it is critical that it is grounded in sound empirical evidence. 2 internal research studies evaluating over 500 fall events were conducted to demonstrate the preliminary reliability and validity of the Humpty Dumpty Falls Assessment Scale. These studies consisted of retrospective chart reviews in which pediatric patients who fell were compared with a control group of patients who did not fall. These studies demonstrated the initial validity of the scale, showing that patients who score as high risk are about twice as likely to fall compared to patients who score as low risk.
We researched available fall prevention programs giving consideration to the tests for compliance as per Accreditation Canada, validated tools, costs involved, ongoing support, and teaching materials, for example. The Humpty Dumpty program met the needs of our program with validated tools for both the inpatient and outpatient populations.
The Falls team meets weekly to evaluate pediatric fall events and to ensure and expand program effectiveness. For example, findings also indicated that children under the age of 3 fell most often, followed by 12-year-olds and older patients with a neurological diagnosis. Furthermore, our nurses have identified post-operative patients as being at risk for falling. Currently, they are translating their knowledge to improve plans of care in the pediatric surgical population. The Nursing Research Department at Nicklaus Children's Hospital is now leading a 5-year multi-site study that began in 2011 to continue measuring and quantifying the impact of the Humpty Dumpty Falls Assessment Scale. As stated by Kimberly DiGirolamo, Children's Hospital Philadelphia found the Humpty Dumpty Fall Prevention Tool sensitivity to be better than their current tool based on internal quality improvement work. Participating in the current research study conducted by Nicklaus Children's Hospital, which examines the psychometrics of the Humpty Dumpty tool, will allow them to reevaluate the sensitivity and specificity of the tool 1 year post. As of today, 14 national and international sites are participating in this study, with another 16 sites preparing to participate. The outcomes of this study will provide important information regarding the continued validity of the Humpty Dumpty Falls Assessment Scale across multiple settings and identify areas for continuous quality improvement of the program. And now I would like to introduce my colleague and Magnet Program Manager, Jenny Cordell.
Thank you, Jessica. Committed to improving the safety of children, Nicklaus Children's Hospital has provided the Humpty Dumpty Falls Prevention Program to organizations worldwide. We are happy to share the good news. Today, more than 1,150 hospitals are actively utilizing the Humpty Dumpty Falls Prevention Program across the world, including over 950 organizations throughout the 50 states. It is now used in every branch of the U.S. Armed Services and is deployed in their hospitals around the globe. The Humpty Dumpty Falls Prevention Program has also been translated into 5 languages and is utilized in 18 countries on 6 continents. Many of you are represented here today, to whom we would like to say thank you. These organizations committed to the care and safety of children continue to experience improved and sustained patient outcomes. Today, the Humpty Dumpty Falls Prevention Program may be the most widely used pediatric falls risk identification tool on the planet. Australia utilizes this falls prevention program in over 100 of its hospitals across the continent.
Hi, I'm Crystal from Logan Hospital in the Metro South Health District, Brisbane, Australia. We decided to implement the Humpty Dumpty program for a few reasons. Mainly we recognised that we were a children's ward in a primarily adult hospital and we had no paediatric falls risk assessment tool at all. From there, we then conducted a review of existing evidence-based paediatric falls tools and we decided that Humpty Dumpty was our winner. With the increase in our services in our district, we needed to also ensure that best practice practice was followed. By implementing this tool, we were highly commended at our accreditation, and we've also had an increase in falls reporting, which has shown that people are more aware of falls in the children's population. Thank you for making the Humpty Dumpty tool available for us to use.
You're welcome. Hospitals in Abu Dhabi offer the program throughout the entire Emirate, serving a population of 1.2 million people. The General Hospital of Itapeceria da Sauda, Sao Paulo, Brazil, has experienced a decline in pediatric patient falls after implementing the Humpty Dumpty Falls Prevention Program from a rate of 1.16 per 1,000 patient days in 2013 to 0.89 per 1,000 patient days in 2014, a 23% decline in only 1 year. With an aim in mind that started simply with innovatively solving a practice problem to keep children safe from falling, the nurse-led team at Nicklaus Children's Hospital has truly made the world safer for hospitalized children. Here, once again, is our amazing CNO, Dr. Jackie Gonzalez, and my terrific colleagues.
Thank you very much, Jenny. So in conclusion, because we're standing between you and celebration, my colleagues at Nicklaus Children's Hospital and I sincerely thank you for allowing us the opportunity to demonstrate our organization's commitment to Magnet and to excellence, along with our mission, which is to inspire hope and promote lifelong health, provided by very remarkable clinicians and nurses who provide the safest and utmost exceptional care to every child and family. Again, I want to thank you, ANCC. I want to thank Cerner also, and probably my most cherished. So I want to thank to our wonderful team in front here below today who's with us, who began small but thought big, and were driven by their passion and love for their patients and families. So Nicklaus Children's, please stand up. Thank you all very much.